Hi, my name's Juliana and this is Dennis, and he's going to be my patient for the physical exam. Is that okay?
Yep.
Okay, great. So I'm going to wash my hands before I get in the room, wash them again when I get in. I'm going to do an overall check, just kind of seeing, is everything normal here? You know, his appearance, is he well dressed? Just kind of an overall perspective of his mannerisms. Throughout the exam, I'm going to be checking his skin. First off, I'm going to check, is he jaundiced? Is there any cyanosis? Temperature, it's warm, it's dry. And then, we'll start with the nails. We'll do capillary refill, less than 3 seconds. No abnormal findings on the nails. The hair, you check for any hair loss, distribution, texture. And then when you want to do the head, you want to palpate. You want to look for any masses, any deformities, anything abnormal that you might find there. And then once you look at the face, you want to look at the eyebrows. You want to see, is there any hair loss? Is it symmetrical? Then you want to check the eyes. You want to look at the eyelids, the lacrimal ducts, the sclera. Is there jaundice? It's not. It's normal. It's white. There's no discharge, no drainage, no swelling. And then my pen light is working, so I'm going to use this. So we want to check the pupils. Are they equal? Yes. They're both round. Check to see if they're reactive to light. Are they constricting? Yes. And then to check for accommodation, you want to just follow my finger. I'm doing finger to the nose, making sure that there's accommodation. And then we can also check the other visual fields with, if I'd be standing right in front of him and doing the finger test, have him tell me if he can see me wiggling my fingers. So tell me look straight at me. Can you see me? Tell me which hand I'm wiggling.
Both.
Okay, good. And then, so that's the eyes. And then we want to go do the ears. So we want to check the auricle, which is the outer ear. Then you want to check, and this is a good time to check for any spots or anything like signs of skin cancer. And then check the mastoid, check for any mastoid tenderness. Same thing for the tragus, palpate that, see if does it hurt anywhere?
No.
And then that's when we'd want to look inside. Okay, and then you can assess the tympanic membrane. It's a pearly gray. No swelling, no discharge, or anything like that. You can ask, have you had any trouble hearing?
No.
No, and then something else to test the hearing would be the whisper test. So I'm gonna stand behind on both sides, just for the purpose of the video. I'll stand here. Just repeat what I say.
Cat.
Correct. And then now we can inspect the nares. Looking inside. Without looking inside, checking for symmetry, a deviated septum. Okay, his is all normal. Then we want to go into the mouth. Have them open up. You can get the light in there. Check the tonsils. Look all around. See if there's any patches or anything. The mucous membranes, are they pink, which is what we want? Are they moist, which is what we want? Anything wrong with the teeth, check for that. Everything in his mouth is normal. No patches, nothing like that. So then the next thing we can do visually is checking if the trachea is midline. His is. Also, another thing you want to do is check the thyroid. If you want to palpate the thyroid, ask them to swallow. Good. And also, while inspecting the neck, we'd want to do some lymph nodes. So we'll do pre-auricular, posterior auricular, tonsillar, and while I'm doing the lymph nodes, I'm using the pads of my fingers to palpate submandibular, submental, and then you want to do the cervical, the anterior cervical, posterior cervical. You want to do the occipital in the back. You want to make sure you do the deep cervical. So the deep cervical, if you have a patient turn the head, you can palpate their deep. So if you have them turn the head, you can feel it down here. Other way, turn the other way. Feel that down there. And then the supraclavicular as well. You want to do that. So also while we're on the neck, we will do the carotid arteries. So we want to auscultate that. We'll do that with the bell. So just gonna listen here. And this is where you want to check for a bruit. There's no bruit here. Check both sides. Good. And then we want to palpate. So that's good, everything's normal. So the next thing we would do is we would do the chest. In a regular exam, the patient's shirt would be off. So we'd be looking at the chest, we'd be feeling for any heaves or lifts, which is the pulsations, the thrills, which is the vibrations. And then just also, of course, a skin inspection, seeing if there's anything bulging or anything like that. And then we could palpate for the apical pulse, which would, my puppy's running up the stairs. Sorry. So sit up straight a little bit. So we'll be palpating for the apical pulse. Make sure you can feel that. And then we'll auscultate. So in the regular exam, I would do bell and diaphragm. Bell to check. Uh-oh.
Accident.
Sorry, he just peed.
Bruce.
So we're gonna auscultate diaphragm and bell. For the sake of this, I'll just do it with the diaphragm. So we'll do
Come here, buddy. Bruce, here.
Come on.
Bruce, here. Here. Bruce. Go get it.
So first, back to this. We'll do the pulmonic, right side, second intercostal space. And then aortic, left side, second intercostal space. Erb's point, left side, third intercostal space, then tricuspid, fourth or fifth intercostal space, and then we want to do the mitral, which is the apex, and that is also in a normal patient, the PMI, so you want to make sure that you're listening to that. When you're auscultating, you want to check for murmurs. We want to hear S1 and S2. Sometimes there can be S3 and S4, which would indicate some issues. But for him, everything sounded normal. Next would be respiratory. So first for breathing, I'm just gonna have him take deep breaths. And I'm gonna come behind and put my palms here, and I'm gonna have him take deep breaths. And I'm gonna be checking for chest expansion, making sure that both of my hands raise evenly at the same time. And then I can check for tactile fremitus. So I'm just gonna have him repeat. I'm gonna keep my hands, I'm gonna move them around the back and the front, and have him repeat the word 99. Go.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And then we can do percuss and then auscultate. So first we'll percuss. So you want to swing to the side. Good. Straight. So first we'll percuss the front. Okay, and then we'll percuss the back. And here we're looking for any like dullness, hyperrenescence, things like that. And then when we're doing this, we're going in like the ladder motion as we listen to, as we palpate, as we percuss all the points. And then we're just gonna do the same, and we're gonna auscultate those. So if you could just take, and this would be with the diaphragm if you wanna take deep breaths. Good. We get the picture. So we do the back, then we do the front. Just want to swing around again. And then as we're listening, so his were normal. There were no adventitious breath sounds. So we'd be listening for maybe some wheezes, maybe some crackles, pleural fiction rubs, rhonchi, but his are completely normal. And then moving on to peripheral vascular. At this part, we would want to check all the pulses. So we would do the brachial pulses. We would do radial pulses. We want to make sure that we feel all of those. And then for that, I'll just do it to me. We would want to check the femoral pulses in the groin area. We would want to check the popliteal pulses behind the knees. And then going down to the feet, we would want to check the dorsalis pedis and the posterior tibial. So we would want to check both of those. Okay.
Bruce, leave it.
Okay. And then another thing that we're looking for, when looking at the legs, we want to check for any ulcers. We want to check to make sure that there's no hair loss, kind of indicating an arterial disease. We want to check for any edema. If there is edema, is it pitting? Is it non-pitting? Just kind of checking the area and making sure it's warm, not hot, not cool. Any signs of DVTs maybe. And that would be then, inspecting the feet if they're diabetic. Also, checking for ulcers and forcing, the importance of foot care, things like that. Something that I did forget was checking the frontal and the maxillary sinuses. So you want to make sure that you just kind of palpate those and check for any tenderness. So that's really it. Do you have any questions?
No.
Perfect. Thanks. Bye.